You're listening to PetLifeRadio.com.
I'm Smiley the dog. I am a mutt. I'm Smiley the dog. I'm super smiley. I have a cat, 2 sweets, the travel kitty, and a big girlfriend, Angel's really pretty. I have a pony and we share a big horse. We have a big yard. Yeah, we have to, of course. I have a pool. In the summer I stay cool. To a fountain, live in the mountain, live high on the hog. Need to be a spokes dog. I'm Smiley the dog. I am a mutt. I'm Smiley the dog. I'm super smiley.
Woof and Super Smiles. Welcome to a Super Smiley adventure on Pet Life Radio, the largest pet radio network in the world. I'm Megan Blake, the pet lifestyle coach, here with my possum sidekick, Super Smiley, the ambassador of kindness for the Animal Film Festival. Here on a Super Smiley adventure, we explore adventures where animals lead. They can be journeys for animal advocacy, for adventure and fun, and they almost always lead to paths of inner discovery and greater bonding with our pets. As the pet lifestyle coach, I travel the country with Smiley, helping people adopt the right pet for their lifestyle and then help train them so they keep that pet forever. And one of the ways we keep our pets forever is with the best health care possible. And that's why we're on it this month with Pet Dental Month. And Super Smiley is perfect for this one. With us today is an amazing veterinarian who was a public health officer for the Air Force. He was the Deputy State Public Health Veterinarian in Kansas. He worked at the UC Davis Teaching Hospital. He's been a guest in lots of media, including Home and Family on Hallmark Channel. And now he's Smiley's super veterinarian here in Malibu, California. He's the owner of the Malibu Vet Clinic. Welcome, Dr. John Lupo. Welcome.
Thank you, Megan. Good to be here.
Yeah. Oh, and first, Dr. Lupo, happy Valentine's Day. That's coming up, so we want to wish you and all your people there at your clinic happy Valentine's Day.
Thank you very much. I'm going to have to make a mark on that so I don't forget. Mark my calendar on that one.
Very good. So, Dr. Lupo, your practice encompasses everything from preventative medicine to surgery and trauma care and nutrition. But right now, we're in Pet Dental Month. So, do we really need like a whole Pet Dental Month? Why is taking care of our pets' teeth so important?
Well, I mean, pets, unlike us, most pets don't get their teeth brushed every day. They don't floss every day. So, it's important. Most of them don't. Some of them probably do. Most don't. So it's important to just, the month of February we designated as, we as in veterinarians in general, as Pet Dental Month, just to really remind us that, pets do have teeth too, and they get the same types of diseases we do, periodontal disease, gingivitis, calculus, all that stuff. And it's just a reminder to just pay attention to all that stuff.
Yeah, it is so important. And Super Smiley and I, we write a blog for Sargent's Pet Health Central. And this month we wrote about Pet Dental Month. And in researching, you mentioned periodontal disease. It was pretty eye-opening, and it was actually a little frightening. I read that by the age of 2, that's just 2 years old, that almost 80% of dogs and 70% of cats have developed periodontal disease. That's huge. Do you see that in pets? Do you see that a lot in your animals that you take care of?
I do. Those figures sound about right, actually, just based on my experience. I mean, I would say, unless it's just a young puppy, a year or two old or less, almost every pet that comes in through my doors, I'm going to see, some form of periodontal disease, whether it be mild or more severe. And of course, the older the pet is, the more often it seems like I see that. So, yeah, those figures sound about right to me.
You mentioned young puppies, and you're right. Whenever I see the puppies, the young, not the little tiny babies with the baby teeth, but the ones that have had their adult teeth for a little while, they're so white and they're so perfect looking. And I always call them puppy teeth. So you really can see a difference as they start to get older, and that really beautiful whiteness goes away. You're right about that. So dental care for pets is not just cosmetic or about doggy breath, but it can mean some serious health issues. Is that right?
Yeah, I mean, there's been some research done on that, and it has been shown that there is a correlation between dogs that have severe periodontal disease and things like kidney disease, heart disease, certain types of heart disease, mitral valve degeneration, those sorts of things. And we think there is a connection between those, yeah.
Wow, that is really important. I'm so glad that we're talking about this. We're going to get more into this. And I know Super Smiley wants to keep his super smile, and we're going to find out more on what we need to do as pet people, pet owners, right after the break. Smiley, can you wait? Good boy.
Sit. Stay. We'll be right back after a short pause. Well, 4 to be exact.
I'm Smiley the dog. I'm Super Smiley. Must rock.
It's designerpetsweaters.com. Hand-knitted designer sweaters for your precious pup or cool cat. beautiful couture patterns for your pets, including custom-knitted formal wear, casual wear, yachting, and even sports-themed. Many designer pet sweaters include feathered tammy hats, top hats, and a lot of sparkle. Each sweater includes leg loops, front paw sleeves, and leash opening. Visit designerpetsweaters.com to order your four-legged fashions today. Your pets will stay warm for the winter and be runway ready. Large or small, we fit them all. designerpetsweaters.com.
Let's Talk Pets on PetLifeRadio.com.
And we're back on a Super Smiley adventure with Dr. John Lupo, Super Smiley super veterinarian here in Malibu, California. Welcome back, Dr. Lupo.
Thank you.
So I mentioned doggy breath. Now, we all know what that means, doggy breath. Is that a normal part of being a dog, or can it mean trouble?
It almost always means trouble. I mean, doggy breath doesn't just happen. Halitosis, there's something there that's causing that, and that something is usually bacteria of some sort, to some degree or another. So what happens is bacteria get in there, they start off with plaque, it winds up as dental calculus, and that bacteria byproducts, as they accumulate, generally starts causing bad breath. And, there's other types of systemic diseases, certain types of systemic diseases, for example, kidney disease can also cause it. But when you talk about mouth pathology, it's almost always related to bacteria and, gingivitis and those things, is that bacteria produces those byproducts that stuff smells, and that's what you're smelling when you smell your dog's bad breath.
So that can be a signal that we need to come to the vet and check it out, right? It's a good signal because it's right there in front of our faces, literally, right?
Exactly. And it's a handy thing to have, actually, to be able to smell that, because that is kind of many times that's an owner's first warning that, something's going wrong. As a matter of fact, a lot of patients that come to me, that's one of the owner's complaints is, my dog's got bad breath. What can I do about it? And, of course, we look into the mouth and we see the pathology there, and we talk about the teeth cleaning, and there's also additives you can add to the water to help with that. But that is a lot of times the first warning that something is going on in there.
Right. And we keep talking about doggy breath, but cats, man, they can have some breath happening, some halitosis too. Is it the same signal for cats, or is it that I'm using all these words that, we have stinky cat food that the cats think is fabulous. So is it from eating that food, or can that also be a signal in kitty cats that there's something wrong with their teeth?
Yeah. No, it's many times it's similar in cats. So as a matter of fact, bad breath in cats can actually mean cats have a particular propensity to get stomatitis, which is a disease that, again, bacteria-related, starts off with simple gingivitis. It grows, and sometimes it can actually get so bad that, certain cats with stomatitis and those types of diseases can actually have to have their teeth extracted as one of the only ways to cure that. But again, one of the first signs of that is bad breath. So, whenever an owner, smells bad breath on a cat, it's probably even more important than in a dog to get them in and get those teeth checked, because cats do have a propensity to get that disease. It's called stomatitis.
Okay, really, really good to know. And in my reading, I read that periodontal disease is the most common health condition in cats and dogs. How accurate is that? That's kind of crazy. The most common? What do you think?
Again, I agree. Like I said, almost every dog that comes into my clinic, unless it's a dog that that the owner is just getting routine dental care, and I say routine, I mean a couple times a year, getting those teeth cleaned, and possibly even giving treats, periodontal treats or additives. I would say almost every dog that comes to my mouth has some degree of dental disease. Now, when I say some degree, some of them are very mild, just a little bit of calculus that you might see in an otherwise healthy dog, and it ranges from that all the way to severe stomatitis, severe periodontal disease, and gingivitis, and that sort of thing.
Yeah. So you're mentioning how it can build up and how serious it is. But let's back up. Let's start at the very beginning. Like I mentioned, when I was researching for our Sergeant's Pet Healthcare blog about Dental Month, it was eye-opening and it was a little frightening. Now, can you explain about, let's back way up to plaque and tartar. We've all heard that on the television commercials, and it sounds, just kind of innocuous to us because we hear about use this toothpaste and, you won't have plaque or tartar. But what exactly is that, and how does it proceed, and how does it affect the gums? Can you tell us a little bit about that?
Sure. Well, plaque is basically a film of bacteria and bacterial byproducts that accumulates in dogs and cats' mouths, as well as our mouths. And in fact, pretty much everybody has, including us people, have some degree of plaque in our mouths at any given time, which is why we brush every day to keep that plaque down to a minimum so it doesn't develop into tartar and calculus. So with dogs, pretty much they all have some degree of plaque. And it's just a matter of how often you can get that off with routine, dental dental prophylactic cleanings to prevent that from building up into calculus, which then, eventually causes, further deterioration in gingivitis and periodontal disease.
When you say calculus, is that tartar? Is that another word for tartar? Because we've heard plaque. And now what's tartar?
Yes. So it starts off as plaque, which is, bacteria and bacterial byproducts in that film that grows. And as that develops and grows over time, you get deposits, mineral deposits, and bacterial debris and gunk kind of get in there. And that turns into then tartar or calculus, which is basically the same thing. So basically calculus is just caked on, nasty, crusty, plaque that has, calcified and got mineral deposits.
So it turns hard and rough. Is that right?
Yes, exactly. It's hard and it sticks on their teeth. And the only way really to get that off is with the prophylactic dental cleaning with, ultrasonic scalers and so forth.
Okay, and so then the tartar, that's the stuff that can get up under the gums and can really cause the serious infection, right?
Correct.
Yeah, that's the part.
Like I said,
that's the part that sounded so scary to me reading. I'm like, oh my gosh, we got to make sure everybody's good. And talking about, okay, now we got it. We see how horrible it is and how it can get up under there. So it can be prevented. I read that this was the most common thing, but it's actually one of the most easily prevented. Is that correct? So that's the good news, right?
Exactly. Just like us. We prevent that from building, the calculus and the tartar from building up on our teeth by brushing our teeth every day and flossing.
Yeah, right.
Dogs, now, so that's one thing you can do with your pet is you can brush their teeth. You can go out and buy toothbrushes with doggy toothpaste, and you can brush their teeth every day, and many clients do. Unfortunately, a lot of clients don't for whatever reason. They don't have time or they're not thinking about it. They're not educated about it. And in those cases, the next best thing you can do is get routine dental cleanings from your veterinarian, and that just involves going in there with a scaler, just like when we go to a dentist to get our teeth clean, and they scale off that dental calculus and clean up the teeth, polish them, and then what you will want to do as a next step is there's water additives that can help prevent that from building up onto the dog's teeth. There's chews, treats that are made specifically to help prevent dental calculus buildup and that sort of thing. And so combining those three, I guess, brushing, prophylactic cleaning, and then appropriate preventative methods like that is basically the best way to keep that off.
That's really, really good information. And then, but probably the first course of action would actually be to go to your veterinarian to assess the issue. Would you recommend that? Do they ever need x-rays? I mean, because when we go, the dentist I know always wants to do x-rays and I usually don't want to do them. So how do we make the decisions for our pets? What do we do?
Well, you hit the nail on the head when you said routine veterinary visits. As part of a physical exam, every dog that comes into my office, I look into their mouth and try to assess the health of the gums and the teeth. In some cases, if I see some pathology in there, or if an owner is complaining of certain symptoms, like, for example, their dog is unable to chew food or dropping food or, halitosis, bad breath, like we talked about earlier, then in certain cases, we may want to do x-rays on a dog. Now, x-raying a dog's teeth is not as easy as it is for us because, generally speaking, you have to put the dog under some form of heavy sedation or anesthesia to do that. But it is something that definitely can be done, and many times is recommended depending on what the veterinarian sees in his initial exam.
Very cool. And you mentioned anesthesia, so I want to hear about the different ways that we can get our dog's teeth clean, what our options are, and more at home right after this break. We'll be right back. Smiley, can you wait? Good boy.
Sit. Stay. We'll be right back, right after we kibble a little with our sponsors.
Hi, this is Tim Link, animal communicator and pet expert and host of Animal Rights on Pet Life Radio. Have you ever wanted to know what your pet is really thinking? Do you want to find out if they truly understand what you're trying to tell them? Ever wish you could build a better understanding and closer relationship with your pet? Well, now you can. Learning to communicate with animals is a 4-part on-demand workshop. In the workshop, you'll learn the essential techniques that are necessary to communicate with animals, including what is animal communication, breathing correctly to achieve the perfect state to communicate with your animals at a deeper level, using guided meditation exercises and method to communicate with animals, and how to send and receive information from your animals. So if you're wanting to learn how to communicate and connect with your animals at a deeper level, visit PetLifeRadio.com/workshop and purchase and download Learning to Communicate with Animals. You'll be glad you did.
Hi, I'm Dana Humphrey, also known as the Pet Lady. I travel from coast to coast to pet trade shows and consumer events to scout out what the hottest, hippest, and most unique pet products are on the planet, bringing you tips and tricks from top veterinarians, groomers, trainers on how to safely travel and live happily with your pets. The Pet Lady will be in a city near you, showing off the latest and greatest tech pet gadgets, cozy comforts, and fab gift ideas for man's and woman's best friend. You can learn more at thepetlady.net or connect socially and tweet with me at PetLadyWorld.
Hey there, pet parents. This is Christy Vaughn, host of The Doggy Dish. Do you love your furry companion? Do you love making him or her healthy treats but can't seem to find the time? Great news. The Doggy Dish is the perfect show for you. Every episode is chock full of healthy and easy recipes that are made with ingredients you most likely have on hand. Tune into The Doggy Dish for yummy and healthy recipes for your canine kids.
Every week, only on PetLifeRadio.com.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Hi, this is Christy Swanson from Buffy the Vampire Slayer, and I'm on a super smiley adventure.
And we're back on a super smiley adventure with Dr. John Lupo from the Malibu Veterinary Clinic in Malibu, California. And we're talking about Pet Dental Month. So, Dr. Lupo, we were talking about both things that we can do at home and the cleaning in the dental, in your office, in the veterinary office. And you mentioned anesthesia. And there are two ways we can go. We can go with anesthesia or non-anesthesia. Can you talk about those choices and what they mean?
Sure. So, historically, most vets, I say historically, back when I first graduated in 1995 and after that and before that, almost all the time whenever we did a teeth cleaning, we would put a dog under anesthesia to do that. And the reason for that is, most vets, and there is some degree of truth to this, is when you have a dog under anesthesia, you can get a little bit deeper under the gum lines. You can get a deeper cleaning, a better cleaning. You're using, it's just you've got a better way to probe the teeth and assess for dental disease and that sort of thing. So in general, it's usually recommended to get an anesthetic cleaning. Now, that being said, if we've done the initial anesthetic cleaning, we've got the teeth clean, it's a regular patient, and I know that the pet has pretty good teeth, and based on my exam, I see that there's not a lot of pathology there, then we can definitely do a non-anesthetic procedure, which is, we get people that really know what they're doing, so it's not just, these folks are usually quite trained in this, and they'll go in there and hold the dog's mouth open with certain tools that they have, and they'll go in there and get a teeth cleaning without anesthesia. And we do that. That's been more and more of a trend lately over the last probably 10 years. And matter of fact, in my practice, I would say, again, once I know the dog is healthy teeth and just needs a routine cleaning, we'll recommend that as routine cleaning and then maybe get an anesthetic dental as needed if things develop from there.
Right. Angel and Smiley, they've had several non-anesthetic cleanings at your facility. And their teeth look great when they come out. They look wonderful. And I would love to watch one of those. So the technician literally just holds their little mouth open like a dentist and scrapes their teeth and dogs sit still. Is that what happens? I'm trying to visualize
surprisingly enough, I've seen cats that I would not want to stick my hand in their mouth, especially cats, but certain dogs too. And these dental technicians do an amazing job of calming the pet down. They kind of put him in this little kind of hold where they kind of straddle the dog between their legs and make the dog comfortable, and they'll put some towels in there to get them all comfortable, and they'll put little cotton rolls or something in their mouth to kind of hold their mouth open, and they're very gentle. They do it very, take it slow. If the dog's giving them a hard time at all, they'll give the dog a break, relax for a few minutes, come back in a few minutes, try it again. I mean, there's no rush. There's very little stress on the animals. It's actually, I honestly don't know how they do it myself. But Maggie, you are absolutely welcome to observe next time we do it on Smiley.
Oh, I would love to do that. Love to do that. That is very cool. I will take you up on that offer. And then you mentioned that some of these things, but once we've gotten our pets' teeth professionally cleaned, you mentioned that we could do at-home brushing. And I read that we should never use human toothpaste. Is that correct? Tell us about that.
Yeah, that's correct. There's some ingredients in human toothpaste that don't settle well with dogs. And remember, when we brush our teeth, we spit out the toothpaste, whereas dogs tend to, swallow it. So there's toothpaste that's made specifically for dogs that's safe to swallow, inert ingredients, and but still does the job of keeping the teeth clean.
Right. So we definitely, let's emphasize that. We don't want to use human toothpaste because I read a couple of reasons that your dog could choke on the foam. They may swallow all this toothpaste. Maybe it's got xylitol in it, which is poisonous to dogs. So there's just a lot of reasons. We should just stick with the, whatever it is, chicken flavor, which sounds horrible too.
Right. And remember, a lot of the beneficiary actions of the teeth cleaning is the actual physical process of brushing the teeth. It's not even It's not even so much the ingredients of the toothpaste. All that's important too. But even just getting in there with a toothbrush and just physically brushing off that film, that plaque that we talked about, is better than nothing.
Right. Could you even use like a rough but very thin washcloth with your finger in it? Would that create enough friction, or is that not really going to do anything? What do you think about that?
That's probably better than nothing, but they actually have little dental rubbers that you can put on your finger, like a little sleeve.
Yeah,
a little sleeve that goes over your finger, exactly, and you can use that to just kind of rub your dog's teeth. And even if your dog doesn't really put up with it at first, dogs can be trained, and really a lot of times it's quite easy with some treats, some positive reinforcement to eventually get a dog that's resistant to that to eventually put up with that.
Yeah, I've done that with Smiley. It was really pretty easy, especially if you give yourself, you're talking about your dental hygienist taking a lot of time. If you give yourself like a week and you let them just lick the toothpaste first, then lick it off your finger, then lick it off the brush, and then just do one little tooth at a time and give them some treats, then pretty soon it's like no big deal to the dog. They'll just lie there.
They almost enjoy it. They think it's a playtime, or it's a special time that they can spend with their owners, and a lot of dogs really look forward to that. Yeah.
Right. And you mentioned the actual physical action. And earlier you mentioned treats that are actually good for cleaning teeth. What about those? Does it say in the packaging? What does it say? How do we know?
Well, a lot of it's the same idea. It's the physical action of the treat as it brushes up against the dog's teeth. It kind of abrades that plaque and it kind of keeps the calculus from forming. But there are certain ingredients in many of these too that also can inhibit bacterial growth. Remember, a lot of it comes down to bacteria. That's the bacteria in there that cause the problems. Our mouths have normal flora, normal bacteria in there, and bacteria are generally good for us. But what we're doing is trying to keep the bad bacteria at bay while keeping the good bacteria, working, doing their jobs, to all the things that bacteria, do in our systems. So it's just kind of keeping a balance. And a lot of it is balance, between our immune system and bacteria. So a lot of dogs that have dental disease, actually, especially, dogs that have chronic dental disease that don't seem to get better with, say, initial teeth cleanings and so forth, or if the plaque and calculus come back shortly after a teeth cleaning, then a lot of times we'll look into things more thoroughly and do some diagnostics, and we find that there's immune-mediated diseases involved and other problems that are causing the teeth problems other than, once we dig deeper into it.
Right. So again, the mouth, the bad breath, or the teeth can be a signal that there's something going wrong. So we need to really, really watch our pets' teeth. And then you mentioned toys. I think you mentioned toys that can encourage chewing, that gently clean the teeth. What do you about that? Do you know anything about the toys?
Exactly. It's similar to, the physical abrasion of rubbing up against the teeth and kind of knocking out that film and those debris before they have a chance to settle on there and turn into calculus, similar to the treats. And then there's water additives as well
tell us about that. Tell us.
So there's water additives that have ingredients, that actually inhibit bacteria. As the dog is, when dogs drink, they lap up their water and it kind of splashes around in their teeth before they have a chance to swallow it. And the idea with those is that the ingredients in some of these mouth washes, if you will, again, prevent the film buildup that eventually turns into calculus and tartar.
Good. And can we get that from our veterinarian, or is that an over-the-counter thing that we look for in the store?
They sell them both, both over-the-counter, and most veterinarians, I suppose, probably keep those. I know we do. We sell those here as well.
Yeah, good to know. I'm going to run down and get some of those. That's great. And then many vet clinics have specials during this month, or they have their non-anesthesia technicians come in, and you have your non-anesthesia people in this month. Is that correct? Or a couple of times a year, right?
Yeah. Every February is Pet Dental Month, and we generally give 20% off. I think most veterinarians will have specials that month. And our dental hygienist, she works all over Southern California, LA area, and she comes to our clinic twice a month. She stays very busy. Like I said, the last 10 years, it's been kind of more and more popular to get dogs' teeth done without anesthesia. But again, I will put a plug in that, again, probably an initial exam from a veterinarian is always, beneficial.
Right, absolutely. And for people across the United States, I love what you mentioned, that your dental technician doesn't stay there all the time, that she travels because it is such a specialty. So just because you don't see a dental technician at your veterinary clinic, call them and find out when they're going to be there, or if they're going to be someplace else where you can catch them at another place and get your pet's teeth cleaned. I love that. That's a really good tip. And then we mentioned Happy Valentine's Day. We have to do this shout out. I know this is a dental show, but I wanted to mention some fun things that we could do for our pets on Valentine's Day. And not only on Valentine's Day, but we could do them every day. One of the things that Smiley loves to do is he likes to go to the big pet stores and pick out his own toy. He walks up and down the aisles. It's so cute. And he'll pick out one that he wants. So Dr. Lupo, do you have a suggestion for everybody to do for their pets? What do you think?
Oh, that's a good question. I tell you what, my dog is 120 pounds. So he's a big boy. And, I bet he would love a romp on the beach. We live here in Malibu, and he just loves running up and down the beach and playing in the water. So maybe we'll do something like that. Or better yet, maybe I'll take him with my wife and I as we celebrate. We've been together 15 years now. Maybe he'll just come with us to the restaurant, and we'll have to give a place at the table.
That would be fun.
My wife would love that.
Yeah, well, we all have love affairs, in quotes, love affairs with our animals. So I think that they would fit right in, especially in Malibu. Malibu is such an animal-friendly place. I don't think anybody would blink an eye except maybe the restaurant owner, but none of the people would blink an eye here in Malibu. And let's see. Oh, another fun thing that I thought of was, how they have doggy play dates. Everybody has doggy play dates. You can actually have a Valentine's play day pet party and bake some pup cakes. I got a great recipe for some pup cakes. And actually, we put the whole recipe on Smiley's Pet Life Radio blog. And so you can go to that easily by going, we got this cool new little URL. You can go to radioblogdog.com, and that'll come right up to Smiley's Pet Life Radio blog. So we'll have some recipes there. And, Dr. Lupo, but we were just talking about the fun things for Valentine's Day. There's some things we should avoid. We all know about chocolate, but can you talk a little bit more maybe about some of the things we should watch out for our dogs on Valentine's Day?
Well, definitely chocolates. Really, and especially during the holidays, people tend to leave these things laying around, and dogs will just jump up on the counter and they'll just go for it. Dark chocolate is specifically bad. Milk chocolate, as most of us know, is mostly just sugar and other, inert ingredients, but it's the dark chocolates that you really have to watch out for. So if you have dark chocolates laying around, definitely put those up in the cabinets. Don't leave them laying around.
Right. And we mentioned xylitol. Some candies, some sugar-free candies have xylitol. And we don't even think about that because you just think it's candy. My dog's not going to eat that. But it can be very, very bad. And raisins. I happen to love chocolate-covered raisins, but I don't even bring raisins in my house. Can you, after I read about what raisins can do, can you talk about how lethal raisins can be for a second?
Well, raisins can definitely be harmful. The thing about raisins is they're unpredictable. Raisins and grapes. Some dogs will eat raisins and they'll be totally fine, and other dogs will eat a couple of raisins and they'll just go into major, organ failure. So I always tell people, just to be safe, definitely keep raisins away from your pets, grapes as well. Play it safe.
Well, that's good to know. And Dr. Lupo, thank you so much for joining us on a super Smiley adventure. And you all have a Facebook page, don't you, where we can keep up? Tell us about your Facebook page.
We do. Well, if you go to MalibuVetClinic.com, it has a link to our Facebook page, and that tells, basically about us and our clinic, and that's probably the best way to get there.
Very cool. And we want to invite everyone also to tweet us at Super Smiley Dog and join us on Facebook at Super Smiley or at Facebook.com/Megan Blake, and follow Smiley's new Pet Life Radio blog at radioblogdog.com. And speaking of Pet Life Radio, without our amazing producer and the co-founder of Pet Life Radio, we wouldn't be here with you. So a huge Super Smiley shout out and thank you to our super producer, Mark Winter. And speaking of Mark, congratulations to Pet Life Radio and to Super Smiley for our nomination for a Dog Writers Association of America Award. And that award ceremony will take place this month. So we're very excited about that. Thank you, DWAA, for that great honor. And Dr. Lupo, thank you again for all you do for animals and for joining us on a Super Smiley adventure.
Thank you so much for having me, Megan, and happy Pet Dental Month, everybody out there.
Yes, happy Pet Dental Month and happy Valentine's Day. And from all of us here at Pet Life Radio on a Super Smiley adventure, we hope you love all your adventures with your pets. And until next time, woof and super smiles.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.